All right, good morning, afternoon, or evening, depending upon when it is that you're listening to this. Welcome to a strange edition of our associate forums here at Buchanan County Health Center, because 2020 has just been that way. But do appreciate you taking some time to click on the associate forum and listen through to some of our organizational updates and some of the other things we have going on. Obviously, it's been a tough last 6 months. I think that's been true across the board. But I am excited that we do have a lot of great things still going on, even in the midst of this being a difficult run. So with that said, I'm going to start out with some organizational updates for all of you. So on the specialty service side, we have actually continued to add quite a few folks coming out here, but also clearly with our new O-line facility, adding specialists there was definitely an opportunity for us. So added to O-line here over the last few months has been the palliative care, memory clinic, and Parkinson's clinic that Joni Henderson has. Pain management now is going up to O-line doing consults. All of our procedures are still coming back to independents, but they are able to alleviate the drive for some of those consults for our patients, and that is the CRNA group that goes up to do those services. We also have vet and psychiatry up there with the addition of Kelly Shepard. I'll talk more about that here in an upcoming slide. On the independent side, this month, appropriately for Breast Care Awareness Month, we did add our breast care specialty clinic with Dr. Gesme and Teresa Borcherding coming out here. They will be coming out twice a month. Had 4 patients on their first day, which is great. And then clearly psychiatry services as well has been added to our independence clinic. We have added a new GI physician also, Dr. Seal. He begins in November. He will be performing procedures here once per month, and then that afternoon be going up to provide specialty clinic services up in O-line. So again, happy to continue to add to our specialty roster that is already pretty full. I have talked about, at least with certain groups, our Jessup Wellness Center. There's been quite a few things going on with this particular project. I did go to the city council meeting a few months back to express our interest in this project, but there's still a lot to iron out. So pre-COVID, we had gotten a site plan done to look at adding a wellness center onto our Jessup Clinic campus, with the goal of expanding wellness services out in Jessup, but also driving more people to that campus. I think we were all pretty excited about that project pre-COVID. Clearly our wellness center membership numbers were at an all-time record high. Definitely felt like that need existed out in Jessup with the closure of the Jessup gym upcoming out there. So very excited about that project. COVID has definitely thrown a wrench into that, either completely or at least from a time frame perspective, before we see really what happens with wellness center memberships coming out of COVID. Have people bought their own equipment, put it in their basement? Are they going to be more leery about returning to a gym? What does that look like? And so wanting to get some more time under our belt to see what happens with our wellness center membership numbers out here before we decide on what an investment should look like out in Jessup. But with that said, we still have options of adding a wellness center onto our clinic. We still are interested in that. The Jessup community is also entertaining a larger facility that if we didn't want to add on to our Jessup clinic for a wellness center, that they may build a wellness space that we could actually lease and operate from the city of Jessup. So that is an option, or obviously not moving forward at all is an option. So I am going to be meeting with a Jessup Community Enhancement Group here shortly to talk through a variety of options while we continue to see what our membership number here in Independence looks like. The organization will also be going through a new strategic planning process, so that'll be happening here this winter and into the spring to develop a new 3-year strategic plan that will launch in July 1 of 2021. A lot has changed in the healthcare industry, so it doesn't seem like a better time really to step back and figure out what we're going to be doing long term to meet our community's needs. I talked about this before certainly, but that integration of pharmacy into our multidisciplinary primary care team is going to be an important thing for us. Pharmacists can really do a lot more than just dispense medication. So we are intending to really get the clinical pharmacy element ingrained into primary care, whether that's medication, education, reconciliation work, or even chronic disease management that pharmacists are doing a lot more of these days. So we are going to be looking with our new retail pharmacy that I'll talk more about to integrate those pharmacists as a part of our overall team. We also are continuing to recruit a new primary care physician. So I've had 2 come in for on-site visits and have another phone interview coming up shortly. Again, the intention is to find a new physician to join our medical associates practice in the fall of 2021. Inpatient remodel has been one of our other large projects that we have been working through. We have gotten a variety of draft plans from Envision developed for inpatient remodel. We initially started with the concept of remodeling in place. But now the board has really given the direction that they would rather see us look at expanding a new footprint off of our campus, likely to the north of where our current inpatient unit sits. What we found in the analysis is that the cost of remodeling our current space wasn't too different from the cost of building out a brand new space. And the other benefit, aside from being brand new, obviously, is if we built a brand new site, we'd actually have vacated space then back in our current campus that we could start filling with some other items. I was a little nervous before we did our medical office building that maybe we had built too much space and would have a hard time filling it. Well, those fears have not been the case at all. We are out of space and actually are struggling to find office space to put individuals in. So having some vacated space back in the hospital will be terrific. We also, in that project, are looking at whatever we do for the inpatient environment to make sure that we take a step back and look at the adjacent spaces to that to figure out, whatever we build, we want to make sure that that works for us to be able to potentially add a 3rd operating room if we ever needed to do that. And so we're going through a little mini master facility plan, at least on that part of the campus, to make sure we could meet all of our needs rather than just focusing on one area at a time. So more to come with that. The good news also with building a new site is that we don't have to lose any of our current service while that's being constructed. So inpatients, skilled, can still be taken care of where they're at. New space gets completed, we simply transition into that, and we don't have to have any sort of loss of service. So that project has been budgeted to occur somewhere between July of 2021 to June of 2023 between all of the design and construction. So really not too far off from where we sit today. One of the big discussions with the inpatient room remodel, the chart that you're looking at right now really shows our number of patient beds and what percent of the time that number met our need. And so the highlighted figure is on 10 patient beds, and what that's showing you is that 95% of the time, 10 patient beds was enough to meet our need. So when we're figuring out how many new beds to build, we don't necessarily want to always just build for that busiest time if those rooms are going to mostly sit empty. So between 10 and 12 beds is likely going to be our sweet spot of where we want to land for inpatient rooms. Even at 12 beds, you see that we meet our needs 99% of the time, which certainly I think is appropriate. The O-Line Pharmacy, definitely we've talked about this a lot. You're looking at pictures of our great pharmacy team that we're very excited to have join us, the 2 pharmacists and the 3 pharmacy techs, all coming over from O-Line Family Pharmacy. The great space that maintenance has worked so hard to get everything up and running in a very short period of time. So thanks to everybody that made this project a reality. To have this come from where it wasn't even on our radar screen that we were going to be doing this on our own, 2 months ago, to where we're going to be opening up a new entity is pretty cool, and it took a lot of great work from a lot of folks. You see our new Chevy Equinox there. That's going to be our delivery vehicle with our logo wrapped. But the community, from everything we're hearing, very excited to have us. That Hy-Vee pharmacy is absolutely overwhelmed with business. So definitely there's wait times there. We'll be able to hopefully alleviate those wait times from from the Hy-Vee pharmacy by having a lot of those patients use us for our medication fills, and really excited to see that get up and running. And by the time you all are watching this, that will be up and running and serving that community. One of the other enhancements that we've been able to make in the organization was one that I actually had talked about at the last associate forum when I was discussing the best ways that we could invest our money to really meet our mission, and that's mental health services. So shortly after COVID had initially hit, we were fortunate to welcome Dan McElroy, mental health counselor, into our organization. Dan came to us from Allen Hospital, from their behavioral health unit. Dan has been a tremendous asset for us. We're seeing his patient volumes really ramping up quickly. The studies that show what is happening with mental health issues, especially in the era of COVID, are pretty staggering. It's more important now than ever that we have those mental health services to meet the needs of the community. And shortly after Dan had started, he was able to put me in touch with Kelly Sheffert, who he had worked with at Allen before, mental health nurse practitioner, and Kelly joined us just about 3 weeks ago as our new psychiatric mental health nurse practitioner. So now we're able to have that prescribing provider here for those services as well. So fortunate to have a great mental health team. Really want to be able to meet those physical needs of the patient, but also meet those mental health needs. And having these two individuals now as a part of our organization will help us meet that mission. Their practice will be a combination of independence and O-line, and then potentially Jessup, depending upon patient volumes coming out of each practice. But I really feel like this is an important step for us to take to meet our mission and provide services to patients that desperately need it. As I talked about in the last associate forum, many patients that need mental health services don't seek that care. And I think having these professionals right up in our primary care office will really enhance the patients seeking the care when and where they need it. So definitely a big welcome to these individuals to help provide mental health services, an important service to our community. All right, one of the other large projects that we have going on right now is our Epic Go Live up in Medical Associates. So very excited to get all of our clinics, hospital, everything onto one EMR. Obviously, Medical Associates was our only part of our organization that was still on a separate EMR. So it would be very excited to have that come under Epic. October 26th is the Go Live Day, so either that has just occurred or it's just going to be occurring here pretty soon for you, depending upon when you're watching. But the benefits of this are clear. Really, that ability for every part of our organization to be able to see those records. So if you're coming into the emergency department, but you're a patient of Medical Associates, that ED provider being able to pull up the chart, easily access those clinic notes will be important for that care continuum. So a lot of good standardization and care coordination work will come out of going live with Epic up in Medical Associates. So real excited to get every part of our organization onto that standard system. The last large project I'm going to speak on is our MRI replacement. So unfortunately, although it turned out to be fortunate, our former MRI system broke down and was unable to be repaired. We have a service contract on that system, and so it's that company's responsibility to really fix the system, get it back up into working order, and cover the expense to do that. They attempted to fix the system multiple times and failed, and spent tens of thousands of dollars in that attempt to fix it. So the company was heavily motivated for us to go out and buy a new system. We hadn't planned to buy a new MRI system until roughly 3 years from now. But with additional negotiation now as a result of this service contract issue, we did go ahead and move up the purchase of a new MRI. What you are looking at right now is 3 different columns. The first column is the specs on our current MRI system. The second column is the specs on the MRI system that we were going to be buying, what we had planned to buy in roughly 2 or 3 years. The final column is the specs of the MRI system that we actually did go out and get. You can see some of the enhancements are the same. So the weight capacity going from 440 to 550, similar between the system that we had planned for versus the system that we had gotten. But you can definitely see a pretty wide discrepancy and enhancement in the channels of the variety of systems between what we had planned for and the system that we actually got. And again, this was due to the service company wanting to get in the system as quick as possible to not have to keep paying the expense of the mobile truck that they're having to pay for right now. So because of that, we really got a Cadillac MRI system. So we're in the process of installing that right now. First patient will likely be done in the first week of November on that new system. But the benefits that our patients will experience faster scan time. So for those of you folks, especially that are claustrophobic, you know that being in that bore isn't the most comfortable thing in the world, although it will be a larger bore now. But getting in and out of there with a 5-minute head CT versus an 18-minute head MRI is going to be a big deal for folks. The images are also going to be significantly enhanced, and we'll be able to do more patients and transfer less away because of that ability to fit the larger patients, both in terms of the weight bearing as well as the size of that bore. So very much looking forward to having our new MRI in place here in the first week of November. I mentioned at the start of this that certainly it's been a strange last 6 months. Clearly COVID being the major rationale for that. I did want to provide a few updates on where we're at with COVID. We talked about it a lot in that March, April, May, June timeframe. But now certainly it's just become part of our everyday life, and we're really seeing those numbers start to climb where it's clear we're going to be dealing with COVID, and not in an insignificant way, for quite a long time to come. The graph that you're looking at is the graph of hospitalized COVID patients from our region. So we're considered in a region that has Waterloo, Cedar Rapids, Dubuque. And so those hospitalizations, you can see, really trended down significantly through July, but then starting in July have really started to increase. And if you look at that tail end now towards October, we are at record hospitalization numbers in our region. The same story is true across the state of Iowa. What we're seeing currently is actually a lot of the hospitals that were accustomed to transferring some of these patients are full, and not just full with COVID patients, but full with inpatients of a wide variety. And so our ability to actually transfer patients away can be a struggle at times. And so we are definitely keeping more patients in our inpatient environment, ensuring that we are planning for making sure that we have all of the appropriate therapeutics to treat COVID-19 patients, because we definitely will be seeing more of them in our inpatient environment moving forward, especially if these hospitalization trends continue, as you see here up on the screen. As of the middle of October, again, things might look a little different now. Buchanan County has 368 positive cases. Fayette County has 251 positive cases. Both still in the bottom half of cases per 100,000 population for all of Iowa counties. But definitely Iowa as a whole is trending upward. So quite a few more cases and a pretty dramatic increase from what we had been seeing prior in the summer. Just over a third of those patients are between 18 to 40. So again, just like some of those trends nationally, a large uptick in those positive COVID patients are coming in that younger demographic. 12% of those cases are with children between 0 and 17 years of age. So definitely going back to school has been a big change, but that's not the majority of the COVID cases that we're seeing is coming out of the school district necessarily. On some other updates, a lot of conversation about a COVID vaccine and when that might be here. Heard anywhere from the last week of October to the first week of November being an initial release of vaccinations for distribution. I think there's been a little bit more uncertainty as of recent in terms of when that initial date will happen and how many vaccines will actually be available, vaccine dosages will actually be available at that time. We do know that they are going to want to target those vaccines to your healthcare workers and to your long-term care residents first. So as these initial waves start coming out in the fall, definitely that will be the initial target of where those vaccinations are given. We have discussed internally, we will not be mandating the vaccine given how new it is, but we'll be recommending it as an organization. Obviously, if there's any federal or state requirements that come about, that would trump our organizational position, but I don't see that happening. Flu season is also upon us. Very important to go out and get your flu shot. We definitely anticipate that we'll be seeing patients that are both COVID and influenza positive. We don't know what that's all going to do to patient outcomes. That's kind of what people are referring to as the twindemic, the pandemic going on of COVID, and at the same time, if an epidemic of flu hits us, what that's going to look like for hospitalizations, but also for outcomes of individuals that happen to have a co-infection of both there. The change in temperature here in Iowa clearly is going to drive people indoors. So those of you that felt comfortable going out and eating out on a patio at a restaurant because of the lower risk, now the decision point is, are you going to not go out to eat at all, or will more people start eating inside? What's that going to do to the spread of COVID? So I think potentially our spread will only enhance as everybody really flocks back indoors with the weather where it can and much more easily spread. So I don't think our trend is going to be much more favorable in terms of those percent of positives. On the favorable side, though, we are enhancing our testing capabilities pretty significantly. So over the last couple weeks in October, getting rapid machines in place at each one of our clinics, in our urgent care, and our emergency department, so we can get quick answers to either rule in or rule out COVID, which is helpful both from a population health standpoint and managing the spread of the disease, but also making those clinical decisions on treatment patterns. So very happy to see our testing capabilities continue to increase. So what can you all be doing? Again, continue to practice that social distancing, no shock there. But that masking will remain incredibly important. So the little graphic that you're seeing up there shows contagion probabilities if one individual or the other is wearing a mask or not wearing a mask. So for example, if the COVID carrier, even if asymptomatic, is not wearing a mask, but the individual that they're around is, about a 70% contagion probability. If the carrier is wearing a mask and the other person is not, that drops to 5%. So again, that concept of your mask isn't necessarily there to protect yourself as much as it's there to protect others. So keep that in mind when you're making your decision about you're really protecting others by putting on that mask, and that's what we're all here to do in healthcare, is to protect others. But if you have both individuals wearing a mask, the carrier and the other individuals around, you can see that probability goes down dramatically from 5% to 1.5%. So, I mean, masks do work, and we are definitely wanting our associates to keep modeling that here at work and in the community. All right, and in case the prior topic wasn't one that you were already sick of hearing about enough in COVID, I wanted to include one more topic that everybody's probably sick of hearing about, but that I like to talk about, so I don't know if this is for your benefit or for mine. But I want to talk a little bit about politics. So what's new in the political arena, besides all the negative ads we'll talk about a little bit, that impact us? The first thing is price transparency. So per a administration regulation that President Trump signed, all of our pricing now, our negotiated payer pricing, now has to be published on our website. And so what the requirement is that there are 70 services that we have to publish our negotiated rates with insurance companies, along with we have to select 230 additional items to publish onto our website. This happens as of January 1, 2021. Right now, we're required to post our charges. Charges, again, are what we charge for the service, but not what we get paid. This change requires us to really publish what we get paid. So there's some benefits to this, and there's some rationale behind it. The publishing of charges is really irrelevant to anybody because it does not tell them they're out of pocket or anything else, doesn't even tell them what we get paid. At least the publishing of these prices says what we get paid. Both the Hospital Association as well as the insurance companies do not want to see this take effect at all, especially the insurance companies. And the reason for that is if we publish that Wellmark, let's say, is paying us $1,000 for an MRI, if I'm just making up numbers, and Allen Hospital publishes and it shows that Wellmark is paying them $2,000 for an MRI, that's going to create questions from us to Wellmark about why the difference, and hurts Wellmark's negotiating position. And so the insurance companies are fighting very hard against this change. The hospitals are fighting against this change because knowing what a hospital gets paid for, again, taking an MRI, for example, does not tell the individual what their out-of-pocket cost is going to be. So whether we get paid $400, $600, or $2, it doesn't tell them if their outpaid or their out-of-pocket expense is $50, $100, or $150. So it's maybe still not giving them the perfect information that they need. I personally am inclined to say that, I understand the reason for this change, even though the Hospital Association would fight against it, even though totally understand that it's not a perfect solution either. A lot has been talked about on the HHS stimulus funds. So these are the additional funds that we got to help supplement some of our losses from the COVID revenue that we lost. A lot of changes in these rules have taken place that might require us to pay back between $3 or $3.5 million of the funds that we took in. I'll talk about that a little bit more when we talk about cash flow. There is a lot more discussion on a new bill that has been presented called the Rural Emergency Hospital Designation. That is a bill that's actually been kicked off by Senator Grassley, which would allow a rural hospital to no longer do inpatient services, but then to get paid more on the outpatient side. There are definitely hospitals in Iowa where it makes sense to make that change. I don't think Buchanan County Health Center is one of them. So not saying that at no point in the future would that ever be a thing that BCHC would look at, but from what our current volumes are, it really doesn't make sense for us to make that change. And so you may hear a lot of stories that come up about that bill, and that is going to be a great bill for some organizations, but not one that BCHC will be entertaining. 340B, our drug discount program that provides us with about $1.5 million to our bottom line, is under pretty constant attack by drug manufacturers. So they are refusing to pay those discounted prices as they are mandated. We are starting to see the government push back on that a little bit, so hopefully this is just a short-term risk, but the government will get it back under control. But again, if the drug manufacturers are successful in making that decline, I guess, to make those payments, there could be significant dollars at risk there. The other piece that's being talked about a lot is telehealth payment parity, essentially meaning that my telehealth service visit is going to be paid at the exact same rate as my in-person office visit. So COVID obviously forced a lot of visits to go to telehealth and has created a lot of momentum for telehealth services and a lot of momentum for the legislature to make a rule that essentially you have to pay the visits the same regardless of telehealth or not. So that hasn't officially passed, but it's probably a very likely one to pass. So again, mentioned topics that we all might be tired about. Negative political ads, certainly one of them. The reason that you're seeing so many of these ads is that Iowa is very much in a battleground state, which again I'll talk about in a moment, but that is why every single ad that comes on TV here in the state of Iowa appears to be a political ad. It is because of how close our race is. I've been approached by many people in the community who have seen the negative ads against the Democratic Party that actually specifically talk about how if you elect Teresa Greenfield, Abby Finkenauer, that 52 rural Iowa hospitals are at risk of closing. So I've been approached by community members who are very concerned about that and asking why that is. Where that comes from is essentially assuming that the Democratic candidates all want to see Medicare for All happen, and I've talked about Medicare for All in a prior associate forum. And if Medicare for All happened, then making the assumption that all of our payment rates are paid at the same rate as Medicare. So if all of our patients across the board were paid at the same rate that we are paid for our Medicare services, that costs us millions of dollars in reimbursement, and for some hospitals, that's enough of a change to make them close their doors. So that is where that claim comes from. Medicare for All, as I've talked about in the past, probably not something that we're going to see in the near future, and definitely if that did end up happening, they couldn't be paying all the hospitals at the same rate as they pay Medicare, because there would be a ton of hospitals across the state and the country that would close, and it just wouldn't be feasible. So I don't think that is actually a legitimate risk with that negative ad attack line, but I just wanted to point that out. On the national election side, the polling data has definitely, again, this all may change here in a week or two if you're viewing this then, but right now we're seeing a pretty dramatic polling improvement for Joe Biden over President Donald Trump. I don't think Kanye West is yet registering in the polls. Can't imagine that he will, but if you want to go that direction, you certainly can. On the U.S. Senate side, right now, the polling is that Democrats are expected to be at about 49 seats in the United States Senate, Republicans sitting at 48 states, and three seats are considered a toss-up, so going one direction or the other. Iowa is one of those states, which again is why you're seeing so many of those ads. So the most likely outcomes, and the reason I talk about this stuff is the political mix, the Democrats versus the Republicans, can be incredibly impactful on healthcare one way or the other. So it's important to kind of see where these are going, because it may have a big impact on our organization. The most likely outcomes are a Democratic control of the President, House, and or Senate and House of Representatives, or Democratic control of the presidency and House of Representatives, which they currently control, but Republicans retaining the Senate. Again, a little bit of a caveat that polling data is not proven to be a super perfect predictor when it comes to President Trump. We saw that a little bit in the last election, but the polling difference wasn't as significant as what we're seeing now. So unless something dramatically changes here in the few weeks leading up to the election, all Vegas bets at this point in time would really be on Joe Biden winning that presidency. So impacts to healthcare, to us, certainly if the Democrats end up controlling all three, the presidency, the Senate, and the House of Representatives, definitely going to see some additional legislation to really shore up that Affordable Care Act, and to potentially enhance insurance coverage for those that still have lacked insurance coverage through what we already have. The Affordable Care Act did enhance our insurance coverage to a certain extent, but probably putting more things on top of that would be the outcome there. If the presidency was retained, but the Senate still ended up being with the Republicans, you're probably going to see not much happen. The president tried to put forward his agenda, House passing a bill, that bill going to the Senate, and that bill stalling out completely in the Senate. So I don't think that you're going to see a lot of differences, if there is that difference between who holds the presidency and who holds the Senate. So if you are a Republican out there, that may not like Trump, but may ultimately be a Republican and want to see the Republicans in control, your world changes pretty significantly if the Republicans end up holding the Senate versus if they don't. And so you're seeing a push for Republicans that may not still want to see Trump in office to still want to go out and vote for their Republican senators, because there will be a pretty big difference if all three are controlled by one party or if you do have a different party in control there. And Iowa's current Senate race is within a couple of points. So definitely, whether you're on that Democratic side and really want to see the three divisions controlled by one entity, or you're on the Republican side and you want to see that not occur and the Republicans retain the Senate, voting in the state of Iowa is incredibly important, not just for the presidency, but for the Senate race. So I definitely encourage all of you to go out and vote, whatever that vote may be.
Election day is on its way, it's such a grand occasion. Time to make decisions for the future of our nation. Candidates are on the stump, podiums are pounded. In the end, the choice is yours, so stand up and be counted. Exercise your right to kick politician booty. Now's the time, and do your patriotic duty. Go vote!
All right, so looking at our financials for last fiscal year, again from July 1 through last June, we had a super solid financial year, all things considered. What you're looking at here does not include the stimulus dollars that we had gotten in. Again, that $3.5 million, because we may need to be paying that back. But you can see, even if we do have to pay back all of those dollars, we still ended our fiscal year incredibly well. So the highlighted areas on the gross patient revenue side, again, even with having to shut down services for multiple months, we still beat our budget by about 1% on the gross patient revenue side. Total operating revenue still beat budget by over 2%. Leading to an operating income of just under $500,000 compared to a budget of $185,000. Total net bottom line just over $1 million compared to a budget of $964,000. So incredibly impressive, again, given what happened in March, April, and June. March, April, May, and June, excuse me. Very, very proud of the work that you all did to help make this happen and to make sure we're still in a stable financial position, even in the midst of COVID. If we had added in the stimulus dollars on the offset of revenue, we would have been at multiple $1 million positive, but again, that money likely having to go back to the federal government. Looking at our cash position, especially important as you are starting to see some hospitals in our region start to do some layoffs and some furloughs. We do not need to be doing any of those items at all. We're still in an incredibly good position. What you are seeing here is our cash position, our total cash, as well as the days cash on hand, which is the red one. The blue line is the total cash. And you can see how that's continued to go up and shot up here in the last quarter. That's really those stimulus dollars coming in. But looking at it, if you take the stimulus dollars out of the equation, what you see is on the blue line still our total cash, and we're still on an increasing position. So again, this is incredibly important as it comes to riding out some of these difficulties that we've experienced through COVID. We're still in an incredibly good financial position, and therefore not having to do those difficult things that you are seeing some hospitals around the region starting to do now. All right, want to finish off with patient satisfaction here. So looking at our patient satisfaction scores for quarter 1 and quarter 2 of 2020. The first chart over here is our ambulatory surgery department, really seeing a lot of favorable scores. The last two columns are the first quarter and second quarter year, but you can see on the prior state to do some comparisons. Excellent scores overall. Looking down at the percentile rank, that's how we rank out of 100 hospitals. So if you are 98th percentile, for instance, you're better than 98 hospitals, and you're worse than 1, essentially, is what the 98th percentile says. Looking at these ambulatory surgery scores, You can see highlighted in green the percentile rank, and you really can't do much better than that, looking at the 99th percentile in an ambulatory surgery environment. So great work on that. In the emergency department, again, if you look at the percentile rank, they're quarter 3 and 4 of our last fiscal year, or last calendar year, excuse me. Really some incredibly strong scores, and still retaining some pretty good scores too into quarter 1 and quarter 2 of this calendar year. So overall, emergency department has been very solid over the last year in terms of what their scores look like, and have had some quarters that they've really shined towards the top there. On the inpatient side, some really good improvement here in the first couple of quarters of this calendar year. So they did have some areas that they struggled in towards the last part of last year, but now you're starting to see that percentile rank really go up significantly in a tremendous quarter 2 of 2020 there, with a lot of green highlighting their improvements from prior quarters. So kudos to the inpatient team for enhancing some of the scores there. On the medical associate side, again, kind of similarly to inpatient, in the 3rd and 4th quarter of last calendar year, didn't see percentile ranks that we ultimately want, but what a great, tremendous improvement here in quarter 1 and quarter 2 of this calendar year. Really starting to get up to that midpoint or even above that midpoint. So some really nice improvement in scores here from the medical associate side. O-line clinic, pretty consistent scores here, looking at that percentile rank, kind of in that 3/4 to 50th percentile on those scores. But I mean, you can see with these scores what it takes to really be in that upper tier, because even with scores of 94, that puts you at the 62nd percentile. So the competition is pretty fierce when it comes to these primary care clinics and where they land, but real solid scores overall for the O-line clinic. Our Jessup clinic, definitely that new entity, so no information in quarter 3 and quarter 4 of last calendar year. Out of the gate though, some very strong patient satisfaction scores here, both in the mean score and the percentile rank. So we've gotten off on a good solid footing there. Hopefully that leads to that reputation and word spreading, and we continue to enhance our patient population seeing us over there in Jessup. Outpatient services. In quarter 2 of 2020, really saw improvements across the board. So you see all the green, meaning that they really improved in every single category. Some terrific percentile ranks there from the April through June timeframe. So great improvements that we saw there in Q2. On urgent care side, again, can't do much better than this in the 2nd quarter with the 99th percentile. So awesome work by our urgent care team, very nicely done. Wound center, you can see consistent, excellent scores across the board. It culminated in the 99th percentile again for quarter 2, but they also were at that same for quarter 1 as well as the 3rd quarter of last year. So tremendous scores across the board on the wound center front. Looking at the rolling 4-quarter averages here across the board. Ambulatory surgery again, very nice improvement quarter over quarter. ED has had some areas that they've had some shining moments, but overall again above the 90 every time. Inpatient, the last 2 quarters shown some nice increases, so good work there. And on the outpatient side, really coming up in quarter 4. On the clinic side, overall just very happy with what we're seeing on that improvement front. So medical associates, O-line clinic, both showing great improvement. Jessup has been up there its first 2 quarters, best quarter of urgent care of all time, and similar in wound center. So some good trends in our clinic environment. We do get ranked on some components against other Unity Point health systems, so wanted to highlight one of those. This is the communication with nurses, and you can see with the star that we were 2nd out of all of the critical access hospitals with our communicate with nurses score of 89%. So excellent work to that team to really rank us high on that particular category. That's incredibly important. I want to leave you with this video of empathy versus sympathy that I thought was a good demonstration of really what the difference is with those 2 topics, and the more we can show our patients that empathetic approach, the better their experience is going to be.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right, on the not so positive approach, 2020 has certainly been filled with a lot more cyber threats, and we're really seeing these become more and more sophisticated. So this slide here shows you what some things that you can be looking for when you are seeing an email that you may be unsure of. So the ability to really hover over that link, and if it's taking you to a website that you totally have no idea what that website is, do not click on that link. If you're seeing misspelled names, do not click on those. Any request that appears urgent, I need this now, you need to pick this up, can you send this to me right away? All of those are pretty fishy. You shouldn't open up any links or do any of those instructions there. But one of the new things that you are seeing now is email addresses getting hacked. And these look very legitimate. They look like they're coming from the individual sending them. So the only way to potentially catch some of these is, and a lot of them are invoices. So if I'm getting an invoice, even though it's from a person that I have received emails for, if I'm not sure why they're sending me an invoice, I'm not opening it until I confirm that that is a real email, and I'm confirming them by calling them and asking them. And I have found 3 that look incredibly legitimate, but upon calling them, they did not send it, and their email account had been hacked. So if it is looking at all askew, do not open up those emails, because that is where the ransomware gets into play. It's really only after it gets through our IT firewall, it's only you that can protect the organization from getting into a very bad situation with our cybersecurity. So if it looks fishy at all, do not open it, and instead have IT review it to see if it is a real thing or not. Employee milestones, so congratulations to those folks passing their 5, 10, 15, 20-year milestones. So completing their 5 years are Amy Ohl, Jenny Goose, Sylvia Gitch, Jennifer Gonzalez, Sarah Elledge, and Jenna Corkery at 10 years for Jenna. Congratulations to all of you folks. Also at 10 years, Sharon, and then 15, Teresa, Tracy, Kevin, Barb, congratulations to all of you. Carol at 20 years and Pam Crosser at 20 years. So congratulations to all of you. And Dr. Jasper passing over his 35-year milestone with the organization. So congratulations to all of you. Thank you for all the work that you've done and the years that you put into Buchanan County Health Center. We wouldn't be anywhere near where we are today without everything that you all contributed. So thank you very much. And with that, we'll end the very strange virtual associate forum. But again, thanks for taking the time to click on this. I'm always happy to take any questions. So if this generated any questions, if there's anything else that you want to know from me, just send me an email and I will be happy to respond to anything that you want to know more about. Thank you.